Hello and welcome to the Campbell University Drug Information Center's newscast. I'm your host for this week's show, Dr. Scott Perkins. In today's show, we'll briefly cover a couple of topics from the past couple of months, including the Infectious Disease Society of America's guideline update on the treatment of C. diff, some recent data describing pharmacists' role in telehealth, appropriately removing penicillin allergies from patients' health profiles, as well as updates on newly approved drugs and indications. So stay tuned. Two new sets of guidelines focusing on the treatment of C. diff infections were recently published. One guideline was jointly sponsored by the Infectious Disease Society of America and Society for Healthcare Epidemiology of America, and the other was from the American College of Gastroenterology. The IDSA-SHEA guidelines now recommend fidaxomicin over vancomycin for initial and for the first recurrent treatment of C. diff infections. The recommendations stem from pooled data suggesting higher sustained clinical response with fidaxomicin compared to oral vancomycin. While this may seem like it could be a valuable option for those at the greatest risk for recurrence, like those 65 or older, those with compromised immunity, or those with ribotype 027, 078, or 244 infections, it's notable that fidaxomicin has not been well studied in these populations. However, the ACG guidelines don't make a clear distinction between their preferred agents, but also provide a strong recommendation for vancomycin for first recurrent CDI versus the conditional recommendation they provide for fidaxomicin. Both guidelines have also now included conditional recommendations for bezlotoxumab for the prevention of recurrent CDI in patients at high risk. In telemedicine news, there have been a couple of interesting studies that have evaluated pharmacists' roles in telemedicine recently. Certainly more than we'll be able to cover today, but we did want to cover two specific studies that were both published in the Journal of the American Pharmacists Association. In a study by Woodhouse and colleagues, pharmacists at St. Joseph's Candler Health System assessed the overall changes in pharmacist managed A1C before and after the increase in telehealth services during the COVID-19 pandemic. The study included 91 patients, 30 in the pre-pandemic group, and 61 in the during pandemic group, with their primary outcome being the change in A1C between groups at 3 months. In the pre-pandemic group, A1C decreased by 1.3%, and in the during pandemic group, the average A1C decreased by 2.2%. At 6 months, the decrease in A1C was 1.2% and 2.2% respectively, so very similar. Certainly, there are some confounding variables to consider, but some interesting results nonetheless. A second study by Warda and Rotolo looked at the willingness of patients to agree to a virtual medication tour with a pharmacist. The study focused on the value and impact a pharmacist can have in the setting of telemedicine by conducting a virtual visit. In the study, the researchers reviewed specific medication storage and organization systems and conducted a medication reconciliation. 13 patients agreed to participate. Patients who participated in the virtual tour were typically white, and the median number of medications that these patients were taking was 17. Only 8 of the 13 patients stored their medications in a medication organization system, and all 13 stored their medications correctly for temperature and humidity. One patient did store their medication inappropriately for light protection, and 3 had stored their medication safely from children. Now, there are a couple of limitations mentioned by the authors in both of these studies, but I encourage you to check them out and see the unique ways that pharmacists are being utilized in telemedicine during the pandemic. Up next, we have a special guest. This is Jasmine Roberts. She is a fourth-year student pharmacist who's currently on my drug information rotation. Jasmine, you had the opportunity to work with Dr. Tara Bell and a fellow student, Phoenix Riley, this past May when you were at Duke Children's Hospital with Dr. Bell's fourth-year rotation. It sounds like you did some pretty cool research while you were up there, so I've brought Jasmine on to talk a little bit about this research, and I'm excited to hear more about it.
Yes, so the pharmacists at Duke University Children's Hospital were able to evaluate penicillin allergies in patients, and we were able to stratify the patients into 3 categories depending on the reaction to the penicillin.
Okay.
And they were split into 3 categories. There was a low risk, moderate risk, or high risk depending on the severity of the reaction. And patients in the low risk category may have had like abdominal pain, headache, nausea, vomiting. And then in the moderate risk category, the patients may have had like angioedema. And then the high risk category, the reaction may have included Stevens-Johnson syndrome or like a more severe systemic reaction. And the patients in the low risk category we were able to remove the penicillin allergy from the patient's medical chart. If they were in the moderate risk, they will be referred for skin testing so that hopefully in the future the penicillin allergy could be removed if it wasn't a severe or a true allergy. Yeah. And then in the moderate risk, the patient's allergy in the high risk, the patient's allergy remained in the chart. And we were able to remove over half of the patients in the low risk category. We were able to remove the penicillin allergy from the chart. However, the ones that remained were patient or parent or guardian preference. They wanted the allergy to remain in the chart. So it was a really unique experience in utilizing pharmacists to improve the patient's care and the healthcare system as a whole, because these patients don't have to be on stronger antibiotics, as they grow into an adult and in the future.
Yeah, especially, penicillin is such an important drug for pediatric patients, so being able to have that as an option on the table again is certainly important. Now, I hear that you are going to be talking about this at a meeting coming up soon, so where are you going to be presenting this at?
Yeah, so we're excited to present this information at ASHP's mid-year conference.
That's awesome. Well, congratulations, and thank you for coming on to talk about the research. So,
thank you.
Awesome. In vaccine-related news, on October 29th, the FDA provided an emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine for children between the ages of 5 to 11 years. The vaccine is provided in a 2-dose series, 3 months apart. This approval is based on an ongoing study which included 4,700 children as young as 5 years old that indicated the vaccine is more than 90% effective in this population. The most common side effects were consistent with those seen in adults, with the exception of fever and chills, which occurred less often in children. The effects generally occurred more commonly with the second dose and resolved after 1 to 2 days. With this authorization, we hope that the infection rates among children and adults can remain low and that we can begin overcoming some of the obstacles presented by COVID-19. So that is all for our pilot episode. Thank you so much for watching. If you know of anyone that you think would benefit from this video, please feel free to share it with them. And since this is our pilot episode, we'd invite you to provide any kind of comments or constructive feedback in the comment section below. Again, thank you so much for watching, and we will see you in January with another episode.